So, access to emergency contraception. All right. So this is just, you know, a way of trying to access the healthcare system of a region. All right. So for this one, you're just trying to say, okay, if somebody mistakenly has like an accidental sex or something, can this person be able to what? Access contraception? Like the person didn't actually plan for it, okay? But can this person be able to access contraception in an emergency situation? Do you understand? So that's what you're trying to access in this place. So this is contraceptions. All right, everybody knows contraceptions. They are could be drugs. It could be what? Materials. All right, that we actually use to be able to prevent pregnancy. You know. So access to it is just an essential aspect of reproductive health. Do you understand? Providing individuals with ability to be able to prevent unintended pregnancy. Maybe the person didn't actually plan to have sex, so they didn't actually plan any contraception. All right, but irrespective, they had the sex. You know, so can they be able to what? Access, contraception ASAP, even as much as they didn't actually plan for it. So types of emergency contraception, we have the emergency contraception pills, usually available over the counter, right? But it's easy to say. In rural areas, you might actually go to a pharmacy and they don't have. Do you understand? So this is just trying to access, how the healthcare system of a place has actually developed to, so that people can be able to even access things even when they didn't actually plan for it. Then the copper intrauterine device, this one, all right, can you be able to access this even when you didn't actually plan for? All right. Then, so what's the benefits of this emergency contraception? Of course, you don't want people to actually get pregnant with babies that they didn't actually prepare to take care of. There's reduction in abortion, all right, because if somebody, if you deny them contraception, later on when the baby is developing, all right, there's abortion, or the person even gives birth and throw the baby away. All right, now societies, we always have those cases of finding babies in dustbins, so you want to actually prevent all those scenarios. Then empowerment and autonomy, all right, empowers the individual to be able to make decisions for themselves. All right, so barriers to access in some places, legal and regulatory restrictions. Maybe contraception is not available, or it's not made available to anybody that is not married. Do you understand? Some places, due to culture, tradition, religion, and all of that, there are rules like that are around contraception, abortion, and all of that. You understand? Then misinformation and stigma. Sometimes it's just that somebody can't access contraception simply because they don't have the information to even know that, all right, contraception exists, or maybe know the location where to actually find the contraception. Then availability and affordability. Is it available? If it is available, can I be able to afford buying it? Do you understand? So those are all the considerations you are looking. So improving access, how can we actually make contraception available to a lot of people? All right. Education and awareness, policy reforms, then healthcare provider training. Our healthcare providers today are supposed to be trained, to know that, okay, this is actually the right of people to actually have this right and have these services rendered to them. Okay, so that's it. I'm trying to look out towards access to emergency contraception.